Heyo, what's up, Z-Pack? It's your boy Z-Dog MD. I am on the road in the Bay Area, broadcasting from an undisclosed, sequestered sabbatical location where the Z family is basically trying to stay sane. Mrs. Dog is working here in the Bay Area, and I am writing a bunch of songs while trying to catch up with a billion years of ignored work. The kids are currently at a band camp, not a real band camp, but I'm going to call it band camp when I tell stories about it in the future. It's a mountain camp down the road. We're in Portola Valley, California, in the Bay Area. It is gorgeous. Yesterday it was about 100 degrees, which is unacceptable because there's no air conditioning in our rental house. This place is pretty dope, though. I'll give you a tour at the end, but you got to stick with me. And since I don't have a specific topic today, I was going to open the floor before I have to pick up my kids from band camp. Open it to questions. You can ask me anything. I have my iPad over here so I can actually see your comments, and they're not on a tiny little whatever the heck. So let's do this. By the way, look at this Viking stove. How dope is that? I lit it up the other day to boil some water, and it was like 10 billion gigabtus of pure heating power. It was incredible. I almost lit myself on fire, which, if you ask my wife, that happens often, whether or not there's 10,000 gigabtus of fire. Hi, Carrie Hinchliff. Renee Hughes says, hey, Z-Dog, what do you think of the truth about cancer on Facebook? Amanda Juarez. I don't know what that is, unless we're talking about, okay, so a lot of people have sent me this video of this doctor standing there going, here's the thing about chemotherapy. It's big chemo and, natural therapies and this and that. And a lot of people are like, well, what do you think of this? And the first thing I say, because it's captioned as a doctor tells the truth about cancer or something along those lines. And the first thing I say is, yeah, he's not a doctor. He's a naturopath. That's not a doctor. Let's move on. Tracy Alex, have you received much negative feedback? And from who mostly? Tracy Alex. Tracy, that all depends on who I've managed to offend that particular week. So there's a list of interest groups that I've pissed off over the time we've been doing Incident Report and before that. And that's what happens when you just authentically tell what you think and you have a discussion that is going to trigger butthurt because you're going to try to see all sides. Now, sometimes you'll take a side, sometimes you'll just expose all the sides, and by not taking a side, people will get butthurt. So my whole philosophy is we got to bring butthurt back. We got to have our, discussions that actually trigger people to get emotionally invested in something, because then we can actually have a conversation. And we also need to do it from a place of respect. That's always a tricky balance. So if there's any criticism of me that I actually take seriously, usually most of it I brush off or I listen to it and I go, okay, that's interesting feedback. No. The feedback I will take seriously is if I've been inappropriately attacky without being compassionate to a particular viewpoint and presenting a balanced sort of at least thought about it. Then I go back and I do that. So I try to make that right. But in general, I try to learn from criticism unless it's typical trolling, which I see quite a bit of recently. And that just makes me think, we've arrived, Z-Pack! Yes! Anytime I put something on YouTube, it's going to get a butt ton of thumbs down, even if it's like, Mother Teresa was a saint. It's like, okay, a bunch of haters. That means we've arrived. What do we got here? Seriously, that stove is amazing, Dawn Michelle. Dawn, if you're good, when we're done with our conversation, I will walk over to that stove and I will fire that Viking up, and it will be like that scene in Raiders of the Lost Ark where the Nazi's faces just melt off, except that Nazi's face will be me. Now look, there's going to be all kinds of comments. Z-Dog MD admits to being a Nazi, poisoning children with HPV vaccine, big pharma shill, big oncology shill, big meat shill. I prefer to think I'm in the pocket of big cheese because big cheese just sounds dope. Do you support a single-payer healthcare system? Kylie Nickel. Kylie, I get asked this question a lot. This is what I support. I support transforming our care system so that it is efficient, outcomes-driven, team-based, and sane and fair to both caregivers and patients. When we get the care system right, then we can figure out how to pay for it, and it'll be easy because it won't be nearly as expensive or wasteful as it is now. So do I think everybody should have access to good healthcare in this country? Yes. Do I think everybody should get everything they want out of a healthcare system? No, because often what we want is not what we need. Often what we do in medicine is not actually helping people. It's actually causing more harm and cost, or at best doing nothing. So we need to get that piece right. We need to provide the right care for the most people at the lowest cost with the best outcomes for the most caregivers and patients together. Patient experience matters, but so does our experience. Now, if a single payer system can convince me that they will fix the care delivery system first, then I will be right in line to vote for it. Until then, all it will do is perpetuate the payment for a broken system, and that will destroy this country. So we have to get that part right, and that means us, frontline care professionals, need to drive that discussion. Not bureaucrats, not administrators, not insurance. They need to be part of the discussion, but they're not driving it. We have to be driving it. And then the government can figure out what's a rational way. If they want to do single payer, how do you pay for it? Now, many people will argue back and say there's no way they can do it without screwing it up. I think if we get a care model right, then you could theoretically pay for it from any source, and it would reduce our paperwork and our other hassle. But you got to get that care model right, and you always need to have an option for physicians and others in the healthcare professions to actually practice off that grid, doing the kind of medicine that they feel is appropriate, as long as they're not harming people and people are willing to pay for it out of pocket. Who are you, says Nick Fury. I am a person, Nick Fury, who wishes they had the handle Nick Fury. That's who I am. Renzo Antonio, no, that's responding to someone else's. Let's see. Preventative care would be nice. Incentives for people to eat healthy and exercise. Emily Ivy. Well, yeah, I mean, I think any good we were talking about Health 3.0 here. How do you build it, right? It's got to involve actually getting paid to prevent disease. Now, how do you even quantify that? So you have to solve that issue. You have to actually look at what data shows. So, you know, my friend Dr. James McCormick up in Vancouver, professor of pharmacy up there, he studies extensively what actually works in medications, interventions, etc. And there's really not a lot. We often are treating surrogate markers, blood pressure, LDL cholesterol. We're not actually looking at the real outcomes, right? Because it's hard to study. So we have to start really putting some investment into the data acquisition that allows us to know what a good outcome is. How do we prevent disease? How do we document prevented disease? It means more personalized medicine, better genomics. That's not the answer to everything, but we do need that as a piece of it. And then we need a space in healthcare where we have the analog relationship, where we have time to spend with our patients, get to know them uniquely, and treat them. A lot of chronic pain patients would be a lot better off having a good, deep relationship with a therapeutic relationship with a caregiver who they can trust and who trusts them and who is their shepherd, than reflexively being prescribed narcotics that don't necessarily help some types of chronic pain. Z-Dog, have you ever done any ride-alongs on an ambulance, says Renzo Antonio. No, I haven't, and I need to do that. That's on my agenda. And what we want to do, though, is we want to do it right. We want to bring if we can, we got to figure out how to do this where we can bring the Tom and Logan and actually do a show where we do a ride-along without violating patient confidentiality, and that's where it gets very tricky. So stay tuned, because we're working on that. Let's see. There's a name that's in Cyrillic that I can't pronounce, but it says, what are some of the biggest well-meaning misconceptions that we civilians hold that medical professionals roll their eyes at? Oh, man, you know, I think this idea that a patient should be empowered is correct. They should be able to search on their own for different information, but coming in with a stack of printouts from variable sources that have very little credibility in the actual medical profession, that's tricky, and you'll often get eye-rolling in front of or behind your back with that, but it's not really your fault. It's the fact that we don't have the time in medicine to actually spend with you to develop the trust and the relationship so that we can curate that experience for you a little better. Instead, it's like, boy, we have 10 minutes to see you, and you've got a stack of papers this big you printed out from the internet. What are we going to do with that now? You know, it's easier just to say, do as I say, because we don't have time, and that's not a good relationship. That's not very therapeutic, and it's not a shared decision-making process. So that's one of the things. There are a lot of other things. In fact, we may do a show on this entirely. What do we got? That's not how they do it on Grey's Anatomy. Mandy Wells. Tom and I want to do a whole show where I watch Grey's Anatomy in real time and respond to all the BS therein, but it's still a very entertaining show. My wife was a big fan when it was in full swing. McDreamy, though. I got a little jealous of McDreamy. Oh, wow, there's such good comments here. Let's see. Let's go back. Have you discussed the nurses' strike? Thoughts, please. Holly Moorhead. Yes, I did. There was a mobile incident report I did a few days back talking about the nurses' strike at Tufts. So please tune into that. And my thoughts out to everybody involved in that on both sides of the equation. What else do we got? Is that a Viking stove? It's a Viking stove, Deborah Montijo, and I will fire it up in a second. Kristen, do you think carnivals eat clowns, or do you think they'd be worried that they taste funny? You know what? This conversation's over because you're clearly paid off by the carnival industrial complex, and if you start talking about clown eating, okay, we see you, Kristen. More comments. Let's go back here. Really like this format. Please do it regularly. Ann Storer. I will, because I have no choice, because sometimes there's just a topic doesn't pop out at me that day. And since I do this daily, if I had to come up with a solid topic every day, I would be like, you know what? I'm just going to eat popcorn and watch TV because this is too hard. Standard American diet right there. By the way, speaking of standard American diet, people sometimes ask, look, you talk about nutrition occasionally. What the hell do you eat? What the health do you eat? Do you see what I did there? I took that stupid documentary and I brought it. Raw mixed nuts. You can't see it because it's backwards. Target. So for the road, I was like, I need something that is good in monounsaturated fats, polyunsaturated fats, low in saturated fats, no salt, and it's unroasted. So because often they'll roast nuts in like, cottonseed oil or oil that may not be as healthy for you, or maybe refined in a way that I don't like, something like that. So raw mixed nuts. Anytime I am feeling snacky, I hit a walnut or so. Now be careful, because the nuts like walnuts that are high in polyunsaturated fats, they tend to go rancid very rapidly when removed from their shells. So a rancid nut is a nut not eaten, so not a very healthy nut. What else we got? Ooh, have you? No, I haven't. Let's see. We have really, Debbie Sadler, we have really done this to ourselves, a nurse from Maryland, or at least that's what it feels like. If you're talking about generally, sorry, I saw Sandy Andrews' comment that just said nut meat and it has a smiley face. If you mean the medical profession has kind of hurt themselves by not really taking care of business ourselves and now letting the bureaucrats and the government officials and the administrators run it for us, then yes, we are absolutely guilty of that. And anyone who denies that is in a delusional state. We have pretty much abdicated our duty to manage our own business, to improve and all of that. And so as a result, everybody else trying to do it for us, and they don't know what they're doing because they ain't clinicians, yo. More comments. Is coconut oil bad to eat? Heather Reese. So this has come out recently where American Heart Association or someone, I forget who, was like, coconut oil was never good for you. Who said that? You're all going to die if you eat it. Listen, guys, let's just be honest here. Real whole food, especially from plant sources, right? But also whole meat sources, fish, chicken, very rare red meat, okay? That stuff is not bad for you in moderation, depending on who you are and your genetics. Coconut oil, okay, it's saturated fat, but it's a kind of saturated fat that many believe is not necessarily harmful. Does it raise your LDL or bad cholesterol? In some it does. Does it also raise your HDL or good cholesterol? In some it does. You'd have to measure and see, and you have to do a trial on yourself. Now, my own experience with eating a lot of coconut oil for my genetics is that my LDL did go up, my HDL also went up, my triglycerides went down, but it was when I was doing a trial of a ketosis diet. So in that setting, I wasn't 100% comfortable with what my lipid response was, although some could argue that it's still not unhealthy. But my total lipid particle count, which is a specialized test that I did with Dr. Peter Attia, who's a friend of mine, who also studies this stuff, it was rather high. So I decided I'm going to back off on those saturated fats for me and go to monounsaturated fats. Lots of olive oil, sardines, those include polyunsaturated fats and omega-3s, right? And more nuts, almonds, macadamia nuts, and I found my lipid panel improved dramatically. My LDL went down, my HDL stayed high, my triglycerides stayed low, and I felt good and I felt full because the high fat content was very satiating. So it's very individual, and again, I'll say this again, and some people actually disagree with this statement, which is crazy to me. Diet is an individual thing. If you are forcing one idea or another on people, okay, and then you're doing them a disservice because you're forcing them into the box that maybe they don't even like that food. How are they going to continue to eat that way, right? You also need to enjoy your life and have it be sustainable. Coconut oil is not, in my opinion, on the list of things that you should avoid, like, say, a trans fat or smoking cigarettes, right? So this is the thing. I think it's much more nuanced than that, and there's data on all sides of the coconut oil question. I was a little surprised when the association came out against coconut oil, but I'm also annoyed with people who think it is a panacea for everything. It is not. All right. I like nuts, says Elizabeth Chickentele. Most of my friends are nuts. What are your ideas on taking a more multidisciplinary approach to healthcare, such as pain management, Hetty Hill? Yes, yes, and yes. That's my take on that. The more multidisciplinary approach you can take, it means it's a team, it means someone's got your back, it means it's like in a cockpit of an airplane. There are protocols and procedures, but people work together in the best interest of the passengers on that plane and themselves, because they're on the ride too. That's how we ought to see healthcare. Multidisciplinary, put protocols where they're appropriate, but violate them when it's appropriate in the service of a unique patient. Look at the big picture in the entire airport and the air traffic for population health, but also look at that passenger in 5C back there who's struggling with air sickness and is panicking, and how do you help them out, right? Do you choose a different flight path that maybe is going to work better for them because less bumpy, or it flies over less water, or whatever is their phobia? So you have to kind of weigh all those things in healthcare, and that means a multidisciplinary approach. All right, what are your thoughts on MD-DO ACGME merger and the future of graduate medical education? Matthew Sorensen. This is a great question. I actually am undereducated in this merger. I've heard about it, and I've heard pros and cons on both sides, so I'm going to research it more and get back to you on that. I will say this. I love my MDs. I love my DOs. I think the more they can work together and collaboratively in their education process, the better it's going to be. But I know there's some downside to this in terms of getting residency spots for some people. So I want to make sure I research that before I try to talk about it and say something dumb. Thoughts on mammograms, Cheryl Foster? Well, this is interesting, Cheryl, because the population health scientist in me is always concerned about over-treatment. So screening too many women too early with mammogram, which may be too sensitive, you find something that maybe never would have evolved into metastatic cancer. It might have regressed, and then we over-treat it and cause complications, stress, anxiety, etc. So that's a downside of mammogram. However, my mother had a mammogram at age 70-something, and they found a 1 centimeter breast mass that had appeared since the last mammogram a year ago. She was getting them yearly because she's relatively good about prevention and paranoid. And the biopsy showed it was estrogen positive breast cancer. So this is the mom, all right, so a few years back. And she had a lumpectomy and radiation at the advice of many sort of doctors that we queried, including my friends and colleagues that I trust. And it was a big deal, but she's better now. Now the question is, did she benefit from that mammogram, and did it save her life? She thinks so. Part of me feels like, did we overtreat something that might have regressed this estrogen positive tumor? And we will never know because we can't study two versions of my mom. In the end, I'm glad my mom had it out. I'm glad she had treatment that if the thing were actually destined to metastasize and become a serious problem, that it saved her life. So that's my thinking on mammograms is, until we know more, I think we have to use them for prevention and we have to advocate them. But I think we should question everything about our preventative tactics, because if we're not seeing actual outcomes, reduced death rate from cancer, right, then we need to ask whether it's doing more harm than good, or whether it's effective. And the same thing goes with prostate screening. So let's have those conversations with experts on the show, because I'm not a breast cancer expert. I just play one on Facebook. As an EMT, I'd like you to discuss our very limited scope of practice of field emergency medicine providers. Any chance you could do a show about it? Owen Wolf. Yes, we are on it, Owen, so stay tuned. We're going to talk about all the things related to that. What else we got? Scroll through here, and I'm going to take you on a tour soon. You did keto. How did you like it? How did you work for you, Renzo Antonio? I did 8 months of a true ketosis diet where I had a blood... It's a repurposed glucose meter that measures with the right strips. It'll measure blood ketone levels too. So truly legit self-testing, bunch of blood tests under medical supervision, ketosis. And I lost a ton of weight. I felt really good, except in the afternoons I didn't feel great. It was really hard to eat on that diet because it was hard to sustain, because it's unlike the Atkins guys, and people get very confused. A ketosis diet means high fat, like 80% of your calories from fat. And I was mostly getting it from monounsaturated fats, olive oils, and animal fats, ghee, butter, cheese, and some meat. And it's hard to eat like that long term. And what I found is, for me, my lipids, again, my total lipid particle count, which is something that's not a standard battery of test, was very high, like 1,700, or 2,000 something, is very high. So my personal genetics don't respond to that. Now, others who are on the same diet get the same testing, and they find that their particle counts plummet. So it's really how you process those saturated fats, how your body turns that. Now, I've said before, dietary cholesterol is much less of a concern for heart disease, and that's not saturated fat. That's dietary cholesterol. Like when you see cholesterol on a nutrition label, that's what they're talking about. That's a different thing. So I did okay in ketosis, but I do much better on a Mediterranean diet personally, which is a higher fat, lower carb, and when I eat carbs, it's usually whole grain or fruits and vegetables without refined sugar, without processed food. So it's just a whole food diet that's high in fish and chicken, some red meat, a little cheese, not much other dairy. I don't do a lot of milk or anything like that. And that's my diet now. And what I find is my lipid panel looks great. I feel good. My blood pressure is normal. My weight is stable. But I also do a bit of intermittent fasting. So I often don't eat breakfast, and a very tiny lunch, maybe a handful of nuts, and then a dinner that's a balanced Mediterranean type of thing. And every now and again, I will cheat as F. And especially when I'm on the road hanging out with Tom Heineber, we'll just eat like pigs and enjoy ourselves. And it's no harm, no foul. Long term, guys. Part of eating is to enjoy life, right? Okay. Let's do a little, let me see if there's any other important comments. Do you think paleo or Mediterranean, Stacy Bueto? I'm a fan of kind of a Mediterranean-ish diet. I like the concept of paleo. I'm not as strict about it. I'm more Mediterranean. So, whole, real food, preferably locally grown if you can, or locally raised if it's meat, and really low in refined carbohydrates and processed food if you can avoid it. Let's see. Okay, I think what we're going to do... Oh, here's a great question. Liliana Cook. Do you trust overweight healthcare providers? What a good question. So how many of us know healthcare providers that are overweight? How many of us may have been healthcare providers that are overweight? So I walked around most of my career at Stanford with my gut hanging out, and because I was eating a standard American diet. And also I was listening to the FDA and the food pyramid and going, I got to eat a lot of carbs and a lot of the bottom of that pyramid, pastas and things like that, and not very much fat. And for me, that was the wrong answer. I don't get full with carbs. I get an insulin secretion. I get very hungry. So more fat. So I was overweight by listening to what the authorities were telling us to do. Now, there are a lot of healthcare providers who struggle with weight because it's multifactorial. There is not a one-size-fits-all. So I would still trust a healthcare provider who's overweight because they may have advice that works for you, but they haven't been able to find the right answer for themselves. And it's very easy to get judgy, but I wouldn't actually. I would cut them some slack and say, each of our struggle is our own. We're trying to do the unique thing for our patients. Now, if they're telling you crazy stuff, then it doesn't matter whether they're thin or obese, you can treat them like they're crazy. But otherwise, I don't know that it's as impactful as it intuitively feels like it is. All right, let's take a quick tour, and then I'm going to go pick up my kids from camp. All right, check this out. By the way, this is how I look at comments now. So there's my iPad, and I can see your comments sort of scrolling, whereas in the old days I had to look at it on the phone, which is not easy to do. How meta is that, by the way? This is what you guys are, the delay in what is actually broadcast from what I'm actually saying. So let's walk around. So this is a really cool rental place, about 1,600 square feet in Portola Valley. Because we have our whole family and my wife is working, we figured it was justified to rent a place instead of staying in a hotel. We're going to be here for about 3 weeks or so. And the kitchen looks like this. And the cool thing, if you guys know Portola Valley, it's just just west of Stanford, up Sand Hill Road, where all the venture capital firms are. And it is this beautiful wooded area where a lot of tech people and older folks live. Look at this. Here's a deck view. So you got this beautiful pine tree. And there's our little rental minivan, by the way, because we're completely domesticated. Really cool forest all around. And it's a very rustic kind of style of house. And this is the deck, and then down there is, you can see there's another deck and a cool little yard right here with a Japanese maple. And let's go on a walkabout in the house. So Mrs. Dog's computer, which is my old computer, my current computer, I brought the monitor because Z-Dog got to edit video and see things big. This is the living room. And then I'll just walk you. There's some cool art here. Look at this. Little Native American action. This is one of the Z-Pups. Oh, is somebody in there? No, it's a stuffed animal. I got scared because Mrs. Dog is hiding. Mrs. Dog is hiding down there. I told her I wouldn't intrude on her. Got a bathroom here. And then another deck. Let's go out here. There it is. Really cool backyard deck. And look at this. Look at this little space. And got a tree there. Got the neighbors bumping some music, which they were doing the other day late at night. Look at this bird, guys. Wait a second. Can you guys see it? Wow, look at that bird. Look at his head. I don't even know what kind of bird that is. Somebody tell me what kind of bird that is. There's another one underneath. I think it's a different kind. Hold on. Pretty cool, eh? That was a sweet bird. You got some neat stuff here. A little barbecue that's gross. You got to see this. Look at this. Barbecue grillware. Ooh. Not using that. Not using that, friends. Let's go back inside before I let the bugs in. All right, and I'll show you the upstairs real quick. Let's do this. Okay, here we go. So that's the staircase up. There are these cool little windows. There's no air conditioning. So yesterday it was super hot. And here's the sort of bigger bedroom and a cool, look at this, cool bathroom with a nice dope shower. So there you have it, my friends. Anyways, let me see if there's some comments here. Not a barbecue grill, just a grill. That's true, Christina Geiger. OMG, no air. Hope you got it for a decent price. We did, Holly. But in the Bay Area, you don't really need air usually, although yesterday it was dang hot. We just open all the windows in the morning and in the evening, and it stays really cool. What else do we got? A flying bird, Gail Cordoza. What do we got? Elizabeth Hudson, gorgeous place, $3.5 million to buy, right? I'll tell you, I Zillowed it because I was like, I wonder what this place costs because it's the Bay Area. And it's a 1,600 square foot place in Portola near Stanford, like 20 minutes away. According to Zillow, it's worth $2 million. It's 1,600 square feet. Okay. That's amazing to me. I'm in the wrong place. All right, let's read some comments. Bay Area has limited AC because usually you don't need it. However, Portola Valley is one that has a microclimate that's hotter than the surrounding areas. Belmont, California, born and raised, aka Blowmont. Caitlin Mirabella. Caitlin, I lived in Belmont for 6 years, and it is freezing cold. Portola is quite a bit warmer than Belmont. We just were up in Belmont yesterday, and you're absolutely right. It's Blowmont. We lived right on Hallmark on that hill, and the fog came in from the bay, and it just blew you off into oblivion. So the Bay Area is full of microclimates. It's an amazing place. I love coming back to visit, but I love Vegas for living because it is so easy to live in Vegas. It's a great place to live. Highly recommend it. And then come and visit the Bay Area with all the money you save living in Vegas. What would 1,600 square feet in Vegas be? Manny Jizrawi, $200,000, maybe, depending on where you are. Maybe less than that. Depends on where you are in Vegas. So there you have it. Try Canada. It's lovely here, Tracy Johnson. I will, and I agree. Until there's an earthquake and it falls off the map, Mandy Wells. You, Mandy, don't jinx us. The last time, well, no, we can't. We went to Napa to visit a few years back, and we got caught in the big Napa earthquake. Woke us up at 3 a.m, shook our entire little townhouse like this, and tossed the kids out of bed and everything. It was pretty amazing. New York City, 200K will get you a shack. Kristen, that's if you're lucky, it'll get you a shack. All right, guys, on that note, I'm going to go pick up my kids from band camp. I will see you guys tomorrow, same bat channel. If you know of people in the Bay Area that I should interview for the show while I'm here, I already know I want to try to hit up a couple pals that would be great to talk to, and we could do it via iPhone. Let me know. Give me some recommendations, and we will make it pop. Peace!